So welcome everybody. Welcome to Living Trans During C19, an online forum for trans and gender diverse people and our allies. My name's Teddy Cook and I'm ACON's Manager of Trans and Gender Diverse Health Equity. We have some incredible speakers here today and I'm so proud to stand before you as an open, visibly-ish man of trans experience, and I'm thrilled, I have to say, to be trans on a daily basis. I'm really delighted that you're all here with us. So thank you. I'm also joined by my incredible partner in crime, Liz Duck-Chong, who's going to introduce our speakers shortly and get things underway. And a huge shout out to the National LGBTI Health Alliance for partnering with us for this event as well. But first, it's so important that we start off proceedings appropriately and by acknowledging that we gather this afternoon, wherever you join us from across New South Wales and Australia, on the stolen lands of First Nations people who were dispossessed by European invasion 250 years ago, and sovereignty has never been ceded. I stand before you today on Gadigal land, which stretches south of Port Jackson, so the Sydney Harbour, from South Head to Petersham, with part of the southern boundary along the Cooks River. The Gadigal people are one of the 29 clan groups of the Eora Nation, which means here, from this place. And local Aboriginal people use that word Eora to describe to the British invaders where they came from. And that word was used then to define the Aboriginal people themselves. And the Sydney Basin, the Eora country, spans from the Georges River and Botany Bay in the south to Port Jackson, Sydney Harbour, north to Pitt Border at the mouth of the Hawkesbury River and west along the river to Parramatta. It's a big place. I celebrate the survival of Aboriginal people and their culture following the impact of European invasion and support their right to determine their own futures. We acknowledge and pay respects to the elders, past, present and emerging, and to all Aboriginal Torres Strait Islanders and also any South Sea Islanders who join us here this afternoon. I also want to acknowledge and pay respects to sister girls, brother boys, and all other trans First Nations people. Trans and gender diverse people are indeed ancient. We have lived, survived, and thrived across every human civilization since the dawn of time and can be traced throughout history. And it's likely that we're part of every Aboriginal and Torres Strait Islander community, and always was, always will be, Aboriginal land. You know, we find ourselves in a grave and truly astonishing moment. This is a time in which there are volcanically intense evolutionary pressures. We're in the midst of an encounter with a collective mortal emergency that completely focuses our attention. Our agency as humans plays a role in how our global community can express itself. The more courage, imagination, and compassion we can bring to bear on these events, the more free and skillful we can be in shaping and reimagining our futures. And so here we are. Welcome. The end of isolation and how we find this new normal is going to take some time, and lots of it. Going back to the life we knew before COVID-19 really would take a significant medical breakthrough, and that could be years from now. And more time after that, as therapies and vaccines are developed to either reduce or eliminate the risk of transmission or decrease the severity of those who do develop COVID-19 illness. So what does this mean? Well, it means that we need to adapt. And what kind of people are amazing at adapting to things like uncertainty, a lack of autonomy, agency and self-determination? Well, trans people. But Australia does continue to flatten the curve, with daily numbers of new COVID-19 cases over the last week significantly lower than the previous week. And this is most certainly not the case in many other countries. And I wanted to share a graphic with you, if I can technology properly. And this graph, can you see the graph for starters? Thumbs up, amazing. This graph that I collected from the World Health Organization this morning shows us the situation around the world. So while we're doing a really great job to flatten the curve here at home, let us remember that our trans family in many other countries are most certainly disproportionately impacted right now. And if you're watching this from a country in the grip of an uncontrolled COVID-19, please know that we stand with you today and every day. I'm grateful that public health is prioritised in Australia. And because of this, we're now beginning to see the gradual lifting of restrictions, and that's really encouraging. It shows that our collective efforts to stop the spread of COVID-19 are working, and it's likely that more restrictions will be eased in coming weeks. ACON and all of our partner organisations will continue to keep you and our communities updated on developments as they come to hand. And everyone plays an essential role in supporting Australia's response. And thank you for doing everything that we can to stop the spread. You know, we can now welcome 2 entire people into our homes, but that doesn't mean a cuddle puddle, I'm sorry to tell you. It means 2 people washing hands thoroughly as soon as they arrive, and then doing what you can to keep 1.5 meters away from each other. But this is not the new normal, but we will need to adapt and lean in with great caution. In the past week, you might have seen some communications from ACON reinforcing our message about casual sex. And in light of the advice from the ongoing need to practice physical distancing, our recommendation to refrain from casual sex still remains. ACON is a fiercely sex-positive organisation. We have never done anything like this before. It's very unusual for us to come out with this sort of recommendation. But we're doing this because we know that it's the best way to keep our communities and those that we interact with safe. We also know that in the last little while, New South Wales has increased the testing or strengthened the testing criteria to include all people with symptoms of fever or an acute respiratory illness, no matter how mild. So don't hesitate to make a telehealth appointment with your GP to arrange testing. And it would be rude not to mention that the COVID Safe app is now a thing. And ACON recommends that our communities take some time to familiarise yourself with the app so you can make an informed decision. I've got to say personally, I've downloaded it and I'm also really looking forward to deleting it. But you do what feels best for you. While restrictions are beginning to ease, many of us are struggling with the effects of social isolation. But please know that organisations like ACON and the Gender Centre and 2010 and QLife and the Inner City Legal Centre are all open and here for you. So, and I promise I'll finish real soon. Why is this forum important? Because trans and gender diverse people and our allies need to know how to stay safe. We know that being trans is not a risk factor for COVID-19, but trans people do report high levels of discrimination and stigma in healthcare settings. We're regularly misgendered, our Medicare cards don't line up with who we are. We spend our time in bathrooms where we need to be right now washing our hands, and they remain highly policed spaces for trans people. Even going to wash our hands leaves us at risk of harassment and violence. Time in hospital is complicated by transphobia from staff and other patients, but while we know that many, many health professionals are incredibly inclusive and dedicated to patient-centred care, this is not always the case. And we must do what we can to protect trans people and other vulnerable and marginalised groups from developing COVID-19. We've developed and put together a dedicated page on Trans Hub, and we'll continue to provide updates up there as well. And ACON's also established a COVID-19 clearinghouse with information and resources galore, and that's available on our website. We've also seen lots and lots and lots of heartwarming and positive stories. And it's important to reflect on the silver linings we're presented with. To see so many people from so many places registering to attend this forum is a really great example of how staying connected and how great we are at staying connected in such a quick period of time. And Kristen, I think that cat does want to be on your lap, but I'm fine with that. I just wanted to let you know that I did notice, and I love it. The people in regional areas can be joining us right now from their lounge room, like Aunty Lisa is. I don't know if you're in your lounge room, close enough. And to be honest, I really can't wait to watch ACON's regional forum this time next week. And I wouldn't be a good nerd if I didn't tell you that there are some really great research opportunities to participate in right now. ACON's Love Project wants to understand more about the best ways to communicate with people from our communities who are aged 45 and above. I'm so close. Equality Australia is also running an LGBTIQ plus COVID-19 survey. And there's a really, really powerful study at the moment called Trust in Digital Health. And this is seeking to understand more about how people from a whole range of different communities, including trans people, choose how to store and share their personal health information. And the ACON Western Sydney Resilience Project is still open as well. We have seen incredible and creative initiatives developed by trans people. Trans Pride Australia are running regular digital hangouts for trans people and allies throughout the week. The amazing folk at the Hunter Gender Alliance have started up a thing called a Discord server. I think that's a gaming thing, which is great to keep people connected. I'm seeing trans DJs and musicians putting on virtual gigs. We've got cooking shows. I'm going to say trans women in particular. Sorry, guys and non-binary pals, but trans women that seem to be building satellites and all sorts of technical wizardry. And I don't know if you watched it over the weekend, but I certainly did. And Equality Australia's Queer Love-In on Saturday was next level, amazing. Please don't get me started on the TikTok dances. Truly, I'm in love. My personal project at the moment is not being injured, so this is great to see. We also received heaps of audience questions. So we put them into themes and we'll do all our best to get to them. But if you did submit a question and we don't get to it, don't worry, because we will email you. So with all of that said, I'm so proud to welcome Liz Duck-Chong, ACON's Trans and Gender Diverse Health Equity Health Promotion Officer, to take over.
Amazing. Hi. Yeah, so basically we're gonna have a chat with this amazing panel that we've got here and ask a few questions, ask a few of the questions that you've sent in previously. And yeah, just hang out for the next hour, which sounds pretty exciting. I'm really keen to have a yarn with this group of people. Thank you all for coming along today. I'm gonna read out a little bit about each of you, but I might give your name, and if you could kind of give me, I don't know, 30 seconds of just a little bit about you, and then we'll get into some of the questions. So first up, I know that the Brady Bunch kind of pattern we've got going here is going to look different for everyone. So I'm saying my left and my right isn't going to work. So I'm just going to work down my list here. Lisa, can we please introduce you? You're a Sistergirl Elder advocate and community organiser. It's so lovely to have you here today. Can you please tell us a little bit about yourself?
Oh yeah, hi, thanks Liz and Teddy for that beautiful welcome. It was lovely. I'm a sister girl. I identify as a sister girl, and I'm from, where am I? People of Port Stephens. I started a Facebook page maybe about 10 years ago for sister girls and brother boys, and I have attended conferences and advocate for sister girls and brother boys around Australia and trans rights. I'm a member of Tekwabi Gears and also have a background of being on Anukana HIV, Indigenous HIV committee for maybe about 10 years. I was on that. So in probably the last 20 years I've been involved in advocating for sister girls and brother boys. And I'm currently based in Bunjalung country in Port Stephens.
I'm so glad to have you here on this web stream today. Thank you so much.
Thanks.
I'm gonna switch next to Panda Cheong, who is a psychologist, community leader, artist, and all-round amazing person. Hi, how are you doing?
Hi, I wouldn't self-identify as an amazing person, but thank you for whoever wrote that about me. I'm good. I'm going to put the psychologist part of me last because I think it's the part of me that I'm probably have the most shame about. I think I'm good. I'm really excited to be here. I'm really excited to hear from all the other speakers as well. And I think that this forum is really important in terms of getting access to information. A bit about me, I don't know. I like riding my bike, and I like my chickens and my dog, and I like critical analysis and thinking, and I like pulling apart psychology and critiquing it as much as I possibly can. I work in private practice, and I mostly work with gender diverse, people of colour, sex workers, sexuality diverse people. Yeah, I think that's all maybe I will say about. Oh, and I'm a psychologist. That last.
Yeah, pop that one last. Yeah. Well, thank you so much. It's lovely to have you here today. We also have the amazing Eloise Brook here, who is the media manager for the Gender Centre. Hi, Eloise.
Hi, how's it going?
Yeah, good. How about you? Oh, sorry, I just muted you there. That was my mistake.
Cool. Yes, I'm the media person for the New South Wales Gender Centre. Also a writer, academic, and podcaster as well. And COVID-19 kind of like experiencer, like all of us as well, to make sense of everything that's happening around us.
Absolutely. And with an amazing background, I got to say, probably my favorite background of the chat here. So well done.
Thank you.
Next up, we've got Mish Pony, who has the most extraordinary set of credits here, but including LGBTI Health Alliance, Transgender Diverse Specialist Advisor, the Trans Rep for Scarlet Alliance, and a board member of AFAO. Welcome. Thank you so much for being here.
Hi, thanks, Liz. Yeah, I'm from the land of the Mongol people. I'm a queer trans woman. I transitioned maybe 10, 12 years ago. At the moment with the Alliance, I'm doing a lot of work in health, and doing a lot of policy and advocacy writing, and yeah, doing some pretty exciting things with them. Yeah, and in my life, I don't know what I do outside of work. I've got kind of 3 jobs at the moment, which I would not do outside of a COVID situation, but it's, you know, stuck at home, got to do something. So that's been pretty good.
Absolutely.
Yeah.
Excellent. Well, thank you so much for being here today. Penultimately, we have the amazing Kristen Davies. Kristen is a senior research fellow of child and adolescent health at Westmead Children's Hospital, and is also, everyone here is fantastic, but I also get to work with Kristen in other forms, and I'm so glad you're here. Welcome.
Thank you so much, Liz and Teddy, for inviting me. I feel really privileged to be part of this webinar with these amazing people, so thank you so much for that. So I'm also a board director alongside Liz and other colleagues at 2010, which I'm sure everyone is familiar with, based in New South Wales, and primarily looking after young sexuality and gender diverse and young people with intersex characteristics as well. So that's fantastic, and I absolutely love doing that. I'm also an adjunct member of SAGA, which is Sexualities and Genders Research. My little cat wants to get involved in the webinar here, at Western Sydney University as well. So, and like Panda, I'm loving cycling at the moment.
Excellent. Well, thank you so much for being here. And finally, last but absolutely not least, we have Dr. Martina Gleeson, who is a gender affirming GP and has probably the coolest headset of anyone here, I've got to say. Welcome.
Thank you.
How are you doing today?
I'm doing okay. Can you hear me? My thing's
Absolutely.
I'm muted.
Yep.
That's good. Yeah. So I'm sitting here in my GP practice in Sutherland Shire, having done a day of mixed consulting, some telehealth, hence the cool headset, and some face-to-face, a little bit more face-to-face every day as people are getting a little bit less scared and coming forward with things that need physical examination for, problems that need a face-to-face consult for, because they've been sitting on those problems for a period, you know, at least 6 weeks. So it's been an interesting journey. The other job I do is I'm the senior clinical lead for the Southeastern Sydney Health Pathways Project, which is a online program for GPs that they can log in, they can get clinical guidance on how to manage certain conditions and then find referral pathways into care in our area. And you can imagine my workload has gone up, it's more than tripled, with working on the COVID-19 guidelines and all of the aspects
Absolutely.
of that, and negotiating with the public health services in our area to make sure that they don't forget that GPs can also support their patients with this illness, and that it's not just a hospital-centric response. So that's where a lot of my energy's been going, too much of it. And when I try to get in touch with the other part of myself that's not the doctor, I love cooking, and I've gone back to sewing because I can't go and watch the theatre, which is my true love.
Well, thank you so much for being here. Thank you, everybody. I'm going to throw us immediately into some questions now and kind of get us going. Martina, I might start off with you just talking about working with different groups of people, and especially your work in kind of working with trans clients and providing gender affirmation. How is COVID-19 playing out in these communities?
So I don't have a lot of trans patients. I wish I had more, but I do have some, and I've been in touch with, you know, about half of them in the last 6 weeks. In some ways, some of the changes that the government's put in has made it easier, because rather than having to make an appointment and come and sit in a waiting room in a conservative white bread suburb and wonder if you're being judged by the other people around you, you can have a telehealth consult and just talk to me and not have to worry about who's in my waiting room. Not have to travel, because sometimes some people that see me don't live close by. They have to make a day trip to come and see me. So being able to log on from the lounge room and have a chat with me via video call is a lot more convenient in some ways. There are some things we can't do. Obviously, we can't do all aspects of a physical examination, but a lot of the time you don't need a physical examination. It's more about assessing how things are going and making sure people's heads in a good space and they're feeling supported, and that I'm doing everything I can to support them as well. So yeah, it's been interesting from that point of view. There's a reluctance to come forward with, you know, and put yourself at risk to come into the practice. That's across the whole community. But at the same time, there is the advantage of actually being able to make contact. For example, one of my patients, I heard on the grapevine that they were very distressed by something that was happening to them. So I was able to get my staff to ring her and say, would you like to have a consultation with Dr. Gleason on the phone today? And we were able to just touch base, and I was able to provide some support for her, which is not something we normally would do in non-COVID times. So it was really lovely to be able to be the kind of doctor I want to be for my patients, to that person.
And I'm sure they're so thankful that you get to be that doctor. I guess I want to open this question up, and indeed all the questions, to everybody here. There isn't really a great system of like jumping in and answering things like there would be if we were live. So please, if you want to chat, either like raise your hand or unmute your mic and just start talking, and we'll figure it out. But I want to pose that question to everybody else in this panel today as well. How are we seeing COVID-19 playing out amongst trans communities? Panda, do you want to go?
I'm not going to talk specifically about any of my clients because of confidentiality reasons, so I'm going to talk more generally. And I just want to make it clear, just in case if any of my clients are listening. For people that I've been working with, there's been, I guess, delays in access to surgery because of the changes that came along with COVID. That's also happened for me as well. Like my surgery has also been delayed. It's a good thing for me because I can save more money to be able to pay for it.
But I can understand that wouldn't be the case for everybody.
For everybody.
Who's going through that. Yeah.
And I think it's like people have waited for a really long time, and for them to kind of hit a wall once that momentum started, there's a lot of grief and loss, I think, as part of that process. And like, yeah, and then other aspects that affect not just trans people or gender diverse people, but people in general. For me, from a mental health perspective, it's more like how it's impacting on mental health more generally.
Yeah, absolutely. And Kristen, did you want to speak to this as well?
And I work mainly with young trans and gender diverse people, so children and adolescents and young adults. And so I've been in touch and spoken to young people and their parents, and also colleagues working in this space as well. And I've heard actually quite mixed reports from young people. So in some cases, parents have reported to me that it's been less stressful, in the sense that young people who may have been having a difficult time at school have got to be at home. And in fact, some of them are ahead of the curve, if you like it, because they'd already been doing homeschooling or kind of mixed schooling, mixed face-to-face schooling, and some online work, and in many respects were ahead of their cisgendered peers when it came to doing schooling online, and then they just didn't have to deal with the day-to-day aspects of going to school and the stresses associated with that. So that's at one end of the spectrum. And then and that's, you know, a young person or young people who have supportive families where it's okay to be at home. And then there have been young people who don't have supportive families and in isolation with their families. So it's been very important for those young people to continue to access services via telehealth. So they're some of the really mixed issues. And then there are young people who are in university, who may be international students and actually have access to no income and may have lost their jobs as well. So it's very, very mixed, I think, the kinds of experiences that are going on. But I just wanted to flag a couple of issues, because I'm also a board director at 2010. So I just wanted to let everyone know that young people can still access food and brokerage and counselling in COVID-19, and you just need to get in touch. And certainly Jane Morley and Terence Humphreys, our executive directors, would love to hear from you. And we encourage all trans and gender diverse young people to follow us on social media and to submit their details via our website if it's safe for you to do so. And you can also call and we can send you information about the digital events that we're running. And this includes really cool stuff like movement, yoga, movie watching parties and hangouts on Discord.
It sounds pretty cool.
We also, just one more thing, we also deliver training to schools and health services and other support services, which may be good during this time. And you can get in touch via training@2010.org.au. Thank you.
Absolutely. Oh, no, you're so welcome. I think I'll also speak on the Site Trans Hub, which you probably heard, or everyone's heard Teddy and I talking endlessly about, but there's also a crisis page there in the My Health section, which has a whole bunch of links out to various services, including 2010 and including other services that are available for different age groups and stuff as well. And so that's a great kind of starting place if you're looking for someone to talk to or somewhere to go, or if you're struggling a little bit at the moment. So you're definitely not alone, and there's kind of all sorts of tools and people out there ready to support you wherever you are. I want to throw you over to you, Mish, and kind of in the work that you're doing and in the communities that you're working with, how are you seeing kind of COVID playing out?
Yeah, well, for the sex worker communities, COVID has been quite devastating because, you know, for most sex workers, it's an in-person service and you can't really do that while social distancing. And so for people that are doing in-person sex work, having, you know, your income pretty much decimated overnight is very difficult. And
Absolutely.
Workers which find accessing the government supports either impossible because they're on temporary visas, or very difficult because of their working circumstances and stigma and discrimination. And there's also been, we've seen some heavy policing of sex worker businesses. And so that's another area you know, sex workers and trans people and trans sex workers in particular have had, you know, a very difficult history with. But more broadly for trans people, yeah, as Panda was talking about, you know, that fear of frustration of, you know, maybe thinking that the pathway you want to be on is on hold, and that's not just surgeries. There's like many other gender affirming things that people undergo that isn't surgery, that still has put on hold, like, you know, hair removal is one of them. And that can be quite frustrating at times. And, you know, you feel that you had this idea of where you wanted to be at a particular date and you have to revise that. But, you know, that also gives you time to grow and rethink some things. And yeah, but that can be hard. What else was I thinking of? And yeah, I think just the disruption of finding new ways to access healthcare. Telehealth is great, but, you know, it's that transition period that's quite difficult of, you know, what do I do now? But hopefully people have been finding those pathways smoother than rocky.
Yeah, fingers crossed, absolutely. Thank you so much. And Lisa, I want to go to you for a little bit and ask about how you're seeing COVID-19 kind of playing around in the communities around you.
Yeah, well, personally, you know, I live on 15 acres in Nimbin, so I'm, you know, it hasn't been too bad for me personally. I've been painting the house and, you know, doing renovations with my husband, and in between, you know, advocating and working with my community, and a lot of we've had some people involved with domestic violence. We've had other people having struggles with housing and, you know, not being able to get housing commission to come in and access things they normally would because of the virus, and so slowing everything down and making it, you know, a very frustrating process, especially for people in, you know, the people that I've been working with that have been involved in domestic violence and at risk in that area. So that's been a bit frustrating, but I think there's also been some positives as well. But also singles, I think a lot of single people have found it a bit more difficult, you know, because they, you know, not living with anybody else. So it's very lonely being on your own. So, you know, I've sort of tried to, you know, hook people up and advocate in that area as well.
Absolutely, yeah. Okay, thank you so much. And finally, I want to go to you, Eloise, and ask about how you're seeing, the kind of effects of COVID in your work with the Gender Centre and kind of broadly out in the community. What are you seeing?
I think there's a couple of major issues here. I think the things that I'm seeing the most of are just generally fear, dealing with isolation. And I think too, something needs to be said about, and I want to say that Teddy alluded to this before, but we have never been anything even remotely like this, ever. The community hasn't. And the system, what I'm seeing, or what I'm trying to come to grips with in what I do, is how to break down the isolation, how to overcome the fear, and also how to find a way to advocate for a community that is the first one that's pushed off the bus when things get difficult, when suddenly it's an emergency. We're the first, one of the first communities to be forgotten or to be pushed aside. So the things that a lot of, I suppose, our work is trying to problem solve going forward, because the way that COVID-19 has been approached in many ways and is still articulated is as a sprint. We have to get in, we have to close this down, we have to change this situation. But it's not a sprint, it's an endurance race. It's going to be here for a very long time. We are going to be dealing with it in some form for a very long time. And the reducing of restrictions that seem to be on the horizon, in a lot of ways, is just the government and the health system being able to say, we can now deal with you becoming infected and ending up in hospital. That's the reality. And I think that's something that we in thinking how to help the community, how to keep our community safe, and problem solving what's on the horizon. These are the kinds of issues that I'm dealing with, or we're dealing with on a daily basis.
Absolutely. I guess in this kind of, endurance race that we're looking at, and looking at the longer term kind of life of what we're all kind of doing and how we're all living and isolating and surviving and hopefully thriving, what are some key things that trans people can be doing to be staying safe and to be looking after ourselves?
I would say that the community members need to think of themselves in essence as really being on the front line. A lot of the systems and medicine that's in place and that we experience, again, doesn't account for a trans experience. So again, as things become even more kind of la-la land, or kind of this strange world we're moving through, the community needs to be mindful. It needs to focus on resilience. It needs to find the resources that community members need. One thing for me that I think to highlight, if there was one thing I was going to say and to really focus on, is this extraordinary shift that we went through in a couple of weeks, where we went from a very consumerist, very kind of market-orientated society that our governments focused us in on economy. And in this most breathtaking change, we moved to back to social health. We jumped in this extraordinary way that I don't think anyone could have completely comprehended, even weeks before. We are now talking in terms of social medicine. We're talking about state, federal government being involved in a way that it hasn't been for a very, very long time. One of the offsets of this that I think we need to consider is that the mindset behind this is about how we are individuals and we navigate a system as individuals, when in fact, nobody or almost nobody does worse in a society that's focused on individuals than trans and gender diverse people. We need to be talking about how we're a community again, or we need to be imagining ourselves as members of a community, because it will be together and working together and pooling our resources and looking after each other that we do well. In the world that I think is now past, but we still are wandering through the remains of this kind of ghost world, that's not for us. And the community, if the community can focus on ourselves as members of a community, how we look out for each other, I think we can pull ourselves through, or we can do better. That's what I would say.
Yeah, absolutely. I think, some kind of building a new world, or a new version of kind of being able to support each other and being a community rather than going back to the way it was.
Absolutely.
Panda, I want to throw to you. Yeah, I guess in your in your professional experience and also your personal experience, what are some of the ways that we can be doing that community building when things like social distancing are, or I guess physical distancing is kind of the more literal way of describing it, are in effect still?
Yeah, I think it's really tricky, because I think if we're starting to do it while we're in crisis, I think if we're starting to try and build community when we're already in crisis, we have to work twice as hard to be able to get the same gains. So I think now, as like the curve's starting to flatten, like this is the time to build community links. But for me, community doesn't just fit within like either trans community or queer community. I think we have to look at community more broadly and in terms of the intersection, so we don't leave anyone behind, so that we don't become homogenous in whatever community is. And to do that, it means that maybe sometimes we have to put ourselves outside of our own comfort zone sometimes, which is hard for trans and gender diverse people because of the potential risks and safety factors and things like that.
Completely.
Yeah, and at the same time, I was reflecting on like the start of the pandemic and who was most at risk at the start. And so people with immune deficiencies, people who were lower income, and thinking about mutual aid and how do we get access to these communities if you don't already have the connections. And so I think now is the time, not just maybe for our own community in terms of trans community, but also wider community for the trans community to build allyship with, so that when crisis happens, those links are already built, which it is as well. Like we already have a lot of those links across different communities. The other thing I wanted to say, just throwing back, it's kind of off topic, just throwing back to what Eloise was saying before about fear. I think I want to normalize fear in terms of what's going on now. So like from a counselling perspective, like I would say fear totally fits the facts of what we're all experiencing. And that if people are feeling scared or anxious or worried, that is a total normal experience to be experiencing right now. And that on some level, we're all probably experiencing it at different levels. I think the tricky part for me is that whatever normal is now, there's no clear idea of what normal is, like in terms of a normal experience or a normal level of anxiety, or a normal level of worry, because the context is totally changed. And so then what I would say to people is trust this part of yourself that knows what is helpful and not helpful for you, in terms of when to kind of push against that fear or that worry and when to kind of move away from it. That everybody has that part of them already that knows what's safe enough for them.
Completely. And I guess kind of building on experience that people may have had kind of with exploring like gender and other bits and pieces, and kind of dealing with, I guess, some of the fear and the apprehension, all those things that are there, and kind of, I guess, using those skills to help us tackle this.
I can't remember who said it before, but like I feel like trans and gender diverse people, like we're already set up, because, you know, I think about like I shouldn't be too judgmental. I think about, because it's not very counselly at all, like I think about cis people and like their experience, and what gender diverse and trans people have to go through. And so already there's a skill set there that people can lean on, because we're used to the struggle, but we're used to thriving in the struggle. We're used to battling for things. We're used to isolation. We're used to discomfort. Like our threshold for discomfort's probably higher. Like there's a whole lot of stuff. Even with mental health stuff, I think it's the same thing. Like if you're used to that level of functioning, like the pandemic, I think at the start for a lot of people, they were like, this is easy. Like I got this. Like I've done this years and years ago. Yeah.
Absolutely. No, thank you so much. Lisa, I want to throw to you for a second and ask kind of, I guess, in the work that you're doing with community and talking with community around you, what are some of the key pieces of advice that you are providing that are kind of out there in terms of trans people feeling safe and supported?
Wow. I'm not much on giving advice, but I don't know, I think I've just been reassuring people to keep their connections happening. You know, a lot of us are quite isolated anyway, and a lot of our communities or our support networks are online. So I think a lot of it's just been going back to that, and, you know, the connections that we've made over the years through social media. And, you know, a lot, you know, one of my biggest supports lives on the other side of the country, so I've been relying on, you know, on her, and, you know, she's another sister girl, and we chat, you know, regularly and talk to each other. So I'd say, you know, just keep connecting online, you know, linking up with people. Yeah. Absolutely.
And I guess engaging with things like this, where you get to see people and hear from people and engage with community and with support.
And, you know, if something's going on for you, you know, the best thing to do is to yarn to somebody else about, you know, what it is. And, you know, it's one of the most healing things you can do, I think, is yarn to somebody about, you know, how you're feeling and where you're at.
Absolutely. Thank you so much. Mish, I want to ask you a kind of, I guess how how you've been supporting community, or how you've seen others supporting community around staying safe, what that's look like.
Yeah, what does that look like? I'm very much into individualized approaches, and I don't think there are blanket statements or blanket rules that work for everyone. And it's all about, you know, working together on what works for the individual. And yeah, nutting that out and nutting out people's fears, and you know, trying to untangle you know, people's thought processes and what's going on for them. But what I'm seeing a lot in trans and sex worker communities is just, you know, it's kind of just, it's the same online and formal and informal networks and support we've kind of been doing for a long time. But, you know, this environment has really put it into overdrive, which, you know, is amazing in some respects and is a recipe for burnout in other respects, and makes us question how sustainable some ways of doing things are. And, you know, I think there is a lot of growth opportunity from this environment, and that's amazing. But also on the same hand, it's really shit for a lot of people, and we shouldn't, you know, look through it with, you know, rose-tinted glasses.
Absolutely. You mentioned the kind of idea there of burnout, which I think I've seen a lot of people talking about, kind of this idea of trying to be the same degree of productive now as they were kind of like 3 or 6 months ago when the context was completely different. Are you kind of seeing some advice in terms of how to prevent, I guess, that kind of that outcome or that mindset?
I don't think anyone's very good at preventing burnout. But you know, I think there is a lot of guilt about not being productive, and that's, you know, the society that we live in. But you know, if you're at home, you know, 24 hours a day, you can't be productive 24 hours a day. And it's just being, you know, it sounds very fluffy and woolly, and I hate this kind of language, but it's about being gentle with yourself and, you know, giving yourself time, and, you know, accepting that, you know, maybe a month is going to be a write-off and you're just going to play video games, and actually that's fine if that's what you need to do.
Completely. I think I agree. I'm usually so like frustrated by self-care language, but I think it really has such a strong value at the moment.
I have to say that I'm absolutely going to do a little extract of Mish saying that. I'm going to put it on my phone ringtone. I'm absolutely not lying. The thought of you saying we just need to be gentle gives me so much love and hope. Thank you.
No worries.
Dr. Martina, I want to take this to you for a second and kind of talk about some of the practicalities around trans people staying safe from COVID-19. Obviously, there are things that we should be doing that everyone should be doing, but kind of, are there any particular, you know, general ways that we should be looking after ourselves and staying healthy at the moment?
Well, you're right. A lot of the things that everybody should be doing. So washing hands, maintaining social, let's not call it social distance. Let's call it physical distance.
Yes.
So maintaining physical distance to just keep your bubble, your physical bubble, so that you're not at risk of droplet spread. The risk is pretty low at the moment because the community incidence level is quite low, but we are expecting the numbers to start going up again with a little bit of loosening of the restrictions. And so people still need to remember the physical distancing and not unnecessarily going out and washing their hands and not touching their face and not coughing out into the air, avoiding people who look visibly unwell with respiratory symptoms. If people in the trans community also have other conditions that might be influencing their immune system, maybe they've got other chronic disease issues, they need to be really making sure that they've got those things under as good control as possible. So people with diabetes, blood pressure, heart disease, lung disease, liver disease, any chronic illness like that, I would say to them, if you haven't seen your doctor in the last 3 months, reach out and get a review of your chronic condition, because keeping your chronic medical conditions under control and well managed is challenging when a lot of our supports are gone. Like, you can't go to the gym anymore, you can't go to your exercise physiologist, you might not be able to access the food that you've been using to help maintain a healthy body weight. So there's a lot of those sorts of things that you might need to chat with a health professional to help you make adaptations to, so that you can keep well looked after in the process of the social and medical changes. I think Teddy also suggests that we talk about making sure your health records are up to date, and your Medicare records, making sure that maybe if you've decided to have an updated My Health record, that it is actually has the information on it that you want to be available. And for some people in the community who are more at risk because of other medical comorbidities, to also have thought about their goals and wishes for treatment, and someone who might be their spokesperson for them if they do need to go to hospital and if they're unable to speak for themselves. And also some communication that they can give to the people looking after them who don't know them if they do have to go to hospital, regarding what their preferred name is, what their pronouns is, the sorts of treatment that you would accept and the sorts of treatment that you would find unacceptable, so that that's there and it can go with you as a document if you do need to go into a medical setting where people are not familiar with you and you're not your best, and you might not be able to advocate for yourself as well as you would usually do. Is that the sort of thing you're thinking of?
Absolutely. There's actually, if you head to the downloads page of TransHub, for people watching this, I think it's literally transhub.org.au/downloads. We have a letter that you can kind of download and print out that kind of, has information that has your name, your pronouns. It can include information around like your gender or gender experience. And having something like that, or having a similar kind of thing on your phone. Some people put it in like the emergency information on their phone, so it's accessible by like doctors and health professionals without needing like the kind of login input. That kind of stuff can be really valuable to kind of help provide that information to people who might not have as close access to it. The letter, I think, is especially good because it has just a little bit of information for doctors or nurses or health professionals who kind of maybe don't have as much kind of interaction with trans people, or aren't as kind of as up as they should be on that kind of stuff. That it has bit of information is like, this is why this is important. Please respect me. Please look after me. So like that kind of stuff can be really, really useful, as you said. And I think it's also, it is worth kind of being, really talking about that there is kind of the risk and the danger in Australia is like incredibly low at the moment. And we're really glad that that's the case, but it is still a really good thing and a really valuable thing to have conversations with loved ones, partners, family members, close friends, kind of about, as you were saying, that stuff around kind of advanced care and how you want things to kind of be and what you want, what your wishes are, and absolutely hoping that those things are never necessary. But I think having those kind of steps in place.
I mean, they're whole of life discussions. Since I was in my 40s, my children have known that I would like to be an organ donor if anyone wants my organs. They've known things that I would want should something happen to me, even though I'm relatively young. But if it becomes a normal thing, then it's not as difficult a conversation to have. The other thing, I mean, everyone's pointing out the importance of staying connected in some way to your people, and just being hopefully able to learn new ways of being in contact, reaching out to people, so that especially for people who live alone, I'm one of them, being creative a little bit with how you manage to stay in contact with people so that it's not such a lonely time, because as has already been said, we thought it was a sprint, but it's an endurance race.
Absolutely. Well, that brings us so beautifully into our next question. Thank you for that. I couldn't have planned it better myself, which is kind of talking about how we do stay connected and what we're doing to stay connected. I mean, I think that the fact that people are watching this, whether it's live at the moment or kind of watching this later on, indicates that you are engaging in some kind of connection with community and with information, and that's absolutely amazing. But sometimes it can also feel a bit overwhelming or a bit difficult And so I guess I wanted to ask this panel kind of what things are you doing to stay connected to people around you? And maybe we can find some like inspiration or some ideas or something like that. Like, for example, I've been doing a gymnastics class for the past kind of year now, which is so much fun. I'm like so bad at being upside down, but we've switched to doing that online now. And I finally figured out how to do a handstand in my bedroom without hurting myself. And I just feel so like connected to that little community. So that's a delight. But this is not time for me to show off. I'm interested in everybody else's bits and pieces. Has anyone got kind of... Eloise, let's go to you. I'm gonna unmute you here.
I'm gonna start small, go big, and then bring it down again. I think
Perfect.
one of the things that's kind of been on my mind, or that's going on at the moment, is that COVID-19 has brought these huge changes. And one of the things that I think we're all noticing is that while there's always that constant or monotonous anti-trans voice out there, in a lot of ways it's quietened down somewhat. There is, I think there's more breathing space around it than there has been for a while. Certainly in Australia. I know it's different. It's certainly different overseas. And the one thing that I've been thinking about, and actually I think a few people here have been a party to this conversation in some form, and it is that our stories, of which we have extraordinary stories to tell, are one of the most fantastic resources to share within the community, and out of the community as well. There's nothing that brings, I think that was Panda said something along the lines that we have a high resilience because of our experiences. And I can't agree with that more, because really that resilience and the stories that comes out of that resilience make us kind of remind us how we're extraordinary people. So taking that, I want to say that in this time, everyone needs to exercise self-care, as already been expressed, absolutely. And that there should be no expectation about curing cancer or kind of reinventing the wheel. But now is the time, I think, when I look out there for trans voices, for trans stories, for even a specific way of reporting about what's happening about COVID-19 in terms of trans people, there's not a lot there. If there are people out there in the community who are looking to to increase community, to join us together, I encourage people to be looking at or finding ways to create content, to do podcasts or whatever it is that kind of floats your boat. Because I think a lot of people tune in, they see us and they're saying, well, when is Teddy going to do it? Or when is Eloise going to do it? Or when is Liz going to do it? And yeah, if there was more of us, we would. But in reality, it's the voices of our community that get added to that are so important. So something that, I want to encourage is, if anyone out there who has podcast ideas, to get in contact with the Gender Centre, have a chat with me. I want more stories. I want more of the incredible, lives that, I have very privileged to kind of encounter, and of a community that I'm part of. So that's I wanted to say that. And then of course, to bring it back, what am I doing? Well, I've suddenly found myself with more time to practice playing mandolin than I have ever in the past. So I have, I've got small children, and so sometimes practicing a mandolin is a really great way to get personal space, to get to leave you alone, because you're making.
As someone who is also practicing a mandolin at the moment, I hear that it's a great way of getting some distance.
It really is. It really is. So yeah, I mean, this could, the next version of this is kind of maybe, TGD talent time, but
Teddy, I think we need to do a talent quest. I think that's what I'm hearing.
We probably should, shouldn't we? Yeah, so that's my...
I'm pretty sure Eloise is up first, so you're in, babe. Let's make it happen.
Only if Liz does mandolin and gymnastics at the same time.
Oh gosh, okay. I'll work on a routine.
Excellent.
Teddy, I want to throw this over to you now as well. What have you been doing?
So I was really lucky in the first sort of number of weeks as we headed into isolation that and Liz, you might recall this, we were really working incredibly hard to be able to deliver Trans Hub. And so once that launched, I suddenly found myself with just 5 minutes of space to think about what was going to happen next. And the way that I've been dealing with isolation and spending a lot of time in my own company, which is, I wouldn't recommend often. It's an interesting place going on in there, but I found actually that I'm not doing big projects. I'm not building things. I'm not even reading books, to be honest. I'm listening to a lot of music. I'm dancing around my house where possible. And really trying to stay connected with my people and with as many trans people and others that I can. I'm normally fairly extroverted, but shocking. But it's been an interesting reflection to actually feel quite resilient at this time, knowing that there is a lot of uncertainty, but sort of recognizing that the supports that I have available and the kind of broader community that is around us means that really I do believe that together we can get through this, and we will get through this. And that sort of, it's been really heartwarming to see so many different events happening. I really think I might actually be a Zoom expert by the time we get back into the office. Sometimes I feel like I'm spending my whole day on Zoom, and that's okay. But new ways to test skills and expand my thinking about how we connect. Really loving connecting with more regional folks again, and just constantly feeling incredibly awe-inspired by the amazing people around me, really.
That's so lovely to hear. Yeah. Panda, I want to switch over to you for a second and kind of, I guess, ask about the ways you've kind of seen people being connected, but also what that might look like for people who have been struggling to find connections before this pandemic. Like, what are kind of ways that we can be seeking out connection at the moment?
I think it's a really good point. I think also because I think we're assuming that connection is easy for people. That's the assumption. And I think about like peeps in our community who maybe are on the autism spectrum where connection is actually really quite tricky, and navigating that is really quite tricky. For me, like, maybe I want to complicate what connection is. Because if we talk about connection in terms of person-to-person connection, that's one thing. And, you know, like what Mish was saying before in terms of individual differences, it really depends on the person in terms of the best way to go about that. But for me, like, connection's also about connecting to nature, or connecting to self, or connecting to community. So like something that I do every day, it's only because I have a dog, I wouldn't do it otherwise. I'm a really lazy person, but every day, like, I'll walk around the block, probably around the same time every day. And so I'm pretty guaranteed to see the same people every single day. And seeing those people out on the street somehow makes me feel more connected to something, whether I don't even have to talk to them. And that isn't for everybody, because some people might be too anxious to leave the house. But I think maybe, like, I want to complicate this idea of connection as in like connecting to things outside of self that might be even more than other people, and it might be even more than just being on technology. It could be just going outside and watching a tree. And I know that sounds really stupid. But then if you do that and just be in that moment, it's freaking so beautiful at the same time.
Completely. Like, I don't know, like ways that other people might like connect with themselves and their bodies, I guess. But like, sometimes I'll have like a really hot shower, or I'll go for a walk, or I'll kind of just like really enjoy like eating some food, or just like lie under all my covers and kind of be like, this feels like really cozy. Like there's a lot of ways to kind of enjoy that like self-connection as well, that aren't necessarily like sexual or erotic in any way either, if that's not people's, you know, preferred experience. There's a lot of ways to kind of engage in that for sure. Teddy, did you have your hand up there, or are you? Nope. Great. Perfect. Did anybody else want to kind of talk about ways they're seeing, I guess, community staying connected at the moment that we can kind of, draw inspiration from, or anything like that? It's also completely okay if not. We've got a few other questions here if we need to get to them.
I'm seeing some really amazing stuff and that I would love to share. Panda, and you're probably seeing some amazing things as well, and everyone. I've been just so regularly inspired by these regular, on very particular days at very particular times, consistently and mostly autonomous spaces for trans people that Trans Pride Australia are running. A hangout that brings people together on a particular theme, sometimes in the morning, sometimes in the afternoon, sometimes about moving your body, and sometimes about having a drink and just connecting and talking. And I just think that kind of activity is so powerful, and particularly for a group of volunteers. And that's the kind of activity that make movements and bring people together. So I just want to do a big shout out to TPA for really leading in that space. It's really, really important, I think.
Absolutely. Thank you so much for that. We've had a huge amount of questions from the audience, both during this session. I know that Teddy, you're like furiously typing and making sure people get some valuable responses there. And we also had
Sorry for the spelling errors if that's happening.
We also had so many questions beforehand as well from people. And we're not going to have time to get through all of those today. We've got kind of, 20 minutes before we should start wrapping up and that kind of thing. As much as we'd like to stay here all night and be chatting with you for as long as possible. But I will kind of ask a couple of these questions. And again, with the panel, please feel free to like put your hand up, jump in at any point, unmute yourself and just start talking. It's pretty free reign here. I guess we've had a few questions from people kind of talking about having either experiencing like increased transphobia in workplaces or housing, or kind of realizing that their families are quite conservative or quite discriminatory because of the close proximity they're in. What are kind of some of the ways that we can be providing advice and guidance for people in those situations where, you know, we're basically having to be at home or around family or people like that far more often, sometimes with detrimental results? Panda, yeah?
Sorry, unmute. Oh, thanks. Sorry. I'm just going to start off the conversation maybe by saying that there's no easy answer to it, and maybe validate that how hard that is right now in the current context.
Yeah, absolutely.
And for me, like the first place that I would start is maybe talking about like a safe enough space in the house that that person feels is theirs. And to have a strategy or a plan to access that space when things get a bit tricky or a bit activating at home. If there's no such space in the house, I would be trying to connect with people who maybe live close by, if that's possible, and negotiate like something with that family or those people around going to that space, because I think the safety need for me is paramount.
Completely. And I guess in terms of like speaking to that need as well, like being able to like leave the house and go for a walk and kind of use that exercise as an excuse to like call Q Life or to call a close friend or something like that. Maybe if you don't feel safe enough to do that at home, then actually kind of using the opportunities you have to be out of the house or to kind of be out of earshot of those people to be finding support and seeking support. Kristen, I wanted to throw to you and ask kind of what some of your thoughts and advice would be for people in this situation.
I think keeping connected is incredibly important. I also think if you're able, that it's a really good time to discuss ground rules if you're in a shared space with someone, if you feel that you're able to do that in terms of kind of mutual respect for each other. I think, you know, lots of people are locked down in situations that are quite challenging. So if it feels safe for you to do that, then it might be a good conversation to have, you know, with people in the household, whether that's a shared you know, situation, family situation, or people are also living in shared living accommodation. So definitely staying connected, and online there are many ways that we can stay connected, but as you were saying, troubling connection is really important. I just wanted to flip back because I didn't get to say something a bit earlier, Liz. I hope that's okay.
Yeah, of course.
Within the paediatric context, there have been lots of, I've spoken to a lot of colleagues, and people are presenting quite late with young people who are quite sick because they're quite afraid to access medical services, so afraid to go to the GP and afraid to turn up to the hospital because of acquiring COVID. And you know, we've been sort of told, I guess, keep away because we'll be overwhelmed. But you know, so there are other things that people are coming in with, and they're quite chronically ill when they're coming in with children and adolescents. So that's just something to be aware of. And another thing is that people are engaging in exercise, really fantastic, but often, you know, there are some accidents happening, like broken limbs and toes, I hear, Teddy, and arms and wrists, and people are at much more risk because they've changed their repertoire of exercise. So they're taking up running and jogging and not stretching and doing that kind of thing as well. So I just wanted to draw attention to that. And I hear trampoline accidents are quite are on the up too. So just backtrack a little bit. So watch out when you're doing those handstands and those new activities that you've done your stretching routine beforehand as well. Sorry to do that segue. Another thing that people are quite concerned about too is falling vaccination rates. So I think everyone is maybe across flu vaccination, and 2010 will be working with Youth Bloc to offer the flu vaccine to young people aged 12 to 15. So get in touch with 2010. But just generally, if you have young people, they're not attending school necessarily, and so therefore they might be missing out on their HPV vaccine, DTPA, and so just to be aware of that as well. Sorry to go on a bit of a tangent, but important.
No, that's just fine. I think one of the things that's really valuable at the moment is to be kind of keeping that connection that we have with our GPs or whoever kind of our main connection with the health community is, actually kind of making sure that connection's open, still doing our regular checkups, even if they're kind of by telehealth. Things like making sure that we're got enough medication and kind of stocking up on the, like, you know, the scripts that we may be running low on and that kind of stuff. And so kind of having that like regular general connection with the medical community and with our health is still really valuable at the moment. And that kind of stuff is still, yeah, incredibly important. Even if we're feeling, you know, like we have no symptoms, your healthcare is still like a really important thing. I guess we're getting close to the end of this session, and I kind of want to, I guess, ask everybody if there's a particular note that you want to end on, or a particular piece of advice or inspiration that you'd love to give our audience before we finish up for the evening. Yeah, I'll throw it open to anybody who would like to start, but whatever form that takes. Aunty Lisa, do you mind if we throw to you first? Put you on the spot there.
Yeah. Yeah. Look, I just think just keep having, you know, make fun of it. Have a good time. You know, we've been I've been making TikTok videos with my very bored 13-year-old daughter.
Oh my gosh.
And, yeah, and my husband, and yeah, made a little video with my husband, and I think just, you know, make the most of it, you know, bond. We've used it as a bonding experience. There's 3 of us here, but, you know, we've had fun with it. But I think, you know, yeah, I don't know. I've got nothing else to add.
No, that's so okay. I think that's, yeah, a really, really valuable point of like finding the connections that we can, I guess, investing in those.
Well, and it's great the house is getting painted as well.
Absolutely. I know, my house is looking so clean. I'm just like spotlessly polishing everything. It's kind of great. Dr. Martina, I want to throw over to you next. Are there any particular things that you kind of want to finish up today on? Any advice or anecdotes or anything like that?
Look, I don't have a lot more advice than what I've given. Stay connected, think about what you need, and then you have the right to ask for it. So think about what you can do for yourself and think about what you can ask for to help you get through this. Be able to collaborate and be able to innovate and do things differently, but still get value out of the things that you're doing differently. Like people have said, gymnastics in the bedroom. and then I guess the other thing is, if you're feeling overwhelmed, think about things that you've enjoyed in the past and that maybe you're not doing anymore. That's what I had to do at Easter time, when I realised that all of my waking hours were consumed with COVID since the January long weekend, and it was too long. And I got back into an old hobby, and now I'm sewing beautiful winter clothes for my great nieces, and I'm really enjoying it. And that's putting me in touch with another part of myself. So it's connecting me, like Panda was saying, to a part of myself that I had left behind, and it's been really hopeful. So hopefully other people have got other things like that in their history that they can connect with that help them get through this.
Completely. Thank you so much. Mish, I want to throw to you next. I know you have a wonderful grin whenever I say your name and throw to you in this chat. But are there any do you have any more lovely words apart from kind of staying gentle and, gentle and caring with yourself?
Yeah, I think it would just be find what works for you and what's, if things aren't working for you, what's missing. For me was going to working from home. I kind of lost all the structure in my life, which I actually needed, and had to find other ways to rebuild that. And yeah, just reiterating what Panda was talking about around staying connected. And that's not the same thing to everyone. That's not having Zoom meetings with friends every day, because for me, that's absolute hell. And I would never want to do that in my life. And yeah, just reach out to those support services that are still operating. For instance, Q Life, like Liz mentioned, is a great resource, and it also does web chat. So, if you aren't able to talk in the house, but you can still chat on your phone in your room, you can use that. And yeah, 2010 is available for people under 25, and all those amazing support resources that are on Trans Hub. Everyone's operating in different ways, but still operating. Yeah.
Absolutely. No, thank you so much. I want to take it to you next, Kristen. Any parting words for our amazing audience who've stuck with us this far?
Yeah, I think staying connected, but I would like to take that further and agree with what Panda said. I went for a bike ride on the weekend, getting back in touch with cycling as opposed to kind of walking. And I was just really aware of cycling and sort of smelling the trees, and also people were having wood fires and all kinds of things. And I was just much more connected to my environment than I think I have been for a long time. So that was really good. I'm also involved in coordinating the health fact sheet for the NGO sector, which will go to the Australian government and to the UN, and will include trans and gender diverse health, and also COVID-19 health. So I will be in touch with all of the panellists and organisations, so that if people feel that there are inequities that that need to be put forward on behalf of the trans and gender diverse community, I'd be very happy to speak with some people about that. What else?
That's amazing. Thank you for that.
I'm also working on a micro array patch, actually, which is pretty exciting. It's a new way of delivering a vaccine, hasn't gone to market yet. So that's another exciting space to watch. It's sort of like a little piece of Velcro, 1 centimetre by 1 centimetre, that gets shot onto the skin, and it doesn't require a cold chain. In other words, it doesn't need to be refrigerated. So bring on that COVID-19 vaccine, I say.
Absolutely. That's amazing. Well, we can't wait to keep watching that space. Eloise, I'm going to throw it to you now. Do you have any final beautiful words for our amazing audience?
I think it's all been summed up so beautifully by everyone who's come before me. But stay safe, and keep, take care of yourself and be prepared for this thing to go on for some time.
Yeah, and I think kind of be thinking about ways to prepare and plan and look after ourselves.
Absolutely.
If/as it does.
Yeah, absolutely.
Thank you so much. Finally, I want to throw to you, Panda, and do you have any kind of final words or thoughts for our amazing, lovely audience here?
So many, but I'm just going to do a really practical one, especially because there's heaps of people in regional communities that are tuning in. I think psychology for the longest time hasn't really engaged in tele or video health. And now for the first time, everybody's accessing like platforms and programs to make it possible. If there was any time to access a counsellor, plus it's also totally okay to ask them to bulk bill. The worst that they could say is no, and then you're in the same place. But I think now is a good time to find someone that you feel like you can connect with, because everyone's using the infrastructure anyway, whereas that infrastructure wasn't there before. And hopefully it can stay. I think it will, because everyone's feeling more comfy with it now that it's been there for
Got our fingers crossed for sure.
Yeah. And so maybe my last thing is don't be afraid to ask for support. Asking for support can be really scary. A lot of people I speak to, me included, the reason why I don't ask for support is because I feel like I'm burdening people. There's this cis white psychologist from the States who once said, I hate quoting anyway, I'll quote them anyway because what they had to say was really helpful, was that the biggest gift you can ever give anyone is to ask them to help you, because it's so, it feels so nice to be able to help somebody else. So if the reason for not asking for help or support is because you're worried about the other person, you're actually giving them a gift in asking. So maybe just wanted to put that out there.
Absolutely. That's such a nice way of thinking about it. Thank you so much. Teddy, how are you feeling? How are you feeling about everything?
I'm feeling incredibly grateful that we were able to come together this afternoon and spend some time. There's something that is just so incredibly powerful and profound when a group of trans people and some of our closest allies come together to kind of get to thinking about how we might use our collective experience to support our community. One of the, I think, really important things that we can do, and Lisa absolutely shared this as well, that as humans, one of the best things that we can do right now is, whenever we find it, if it comes, to enjoy every moment we possibly can. When something arises, if you're feeling sad, that you're feeling good, we feel guilty about actually going okay. That's okay. It's okay. Sometimes reaching out for help, sharing your experience. I've established a new relationship with the way that I engage with social media. And I feel like this is an opportunity for us to reimagine a future. I don't know if I want to live in a world that we came from. We lived in a world where many, many people that I know couldn't leave the house because it's scary to do so. Tell you what, if you're a cis person, you want to know what it's like to be trans, you're living it right now in lots of cases. It can be really scary to leave the house. And I think we have an incredible opportunity to, I guess, reconsider and expand on how we consider community and, like Panda said, connection, and what the future holds. I am a big fan of collaboration. It's really, really important to me. It's an important value that I hold. And I'm really, really excited to see a future near, very, very soon, when those opportunities to connect and collaborate and build go next level, because I certainly know that ACON's here for that. and we're absolutely here for you. Thank you so much.
Absolutely. Thank you so much. And thank you to our incredible panel for, the amazing work that you continue to do, the amazing work that you've done today in this past kind of couple of hours. And yeah, that I just can't wait to keep working with you over the coming months and hopefully years, and keeping in touch with everybody who's watching this. Like, please keep sending us your questions. Please get in touch with all of the various services that are available to you around New South Wales and around Australia. And so many of those are linked through Trans Hub, which is just has so much information there, and so many kind of links to services and resources and organisations, and just ways to kind of be supported and loved and looked after. So please do not hesitate to kind of check that out, and check out all the amazing organisations that are spruiked and supported through that resource as well. And yeah, take care of yourselves. Like, be safe at the moment. Be, a healthy amount of cautious, but also, as so many people have said, find the joy, find the kind of being in touch with yourself, find ways of being supported and supporting others. I think it's really important. We just had a comment before saying to mention the regional ACON officers who do incredible work always, but are available and open at the moment. And so if you're kind of in various regional and rural areas, get in touch with them and they can support you, care for you, hook you up with services. So make use of the services that are available. And yeah, I guess until the next panel, that's it from us. Thank you all so much for being a part of this.
I'm really looking forward to more opportunities for us to do things like this. I kind of get a sense that people might be into it. If you are interested in being a panelist or participating in some way as a volunteer, see how we go. Maybe I'll buy you a coffee when we're done. That's how I got these crew together. Please do reach out, because
do get in touch.
Yeah, we're, the Gender Centre is absolutely here for you. 2010, Q-Life, the LGBTI Health Alliance, Sister Girls and Brother Boys, Australia, your doctor, your psychologist. I've got to say, I've never had a forum that I've invited a psychologist to come and speak to trans people. And I'm very glad that it was you, Panda. And, and for Dr. Martina, you say you don't have many trans patients, but that's a lie. You're doing incredible work in this space, and keep doing it, because we need more GPs like you to be able to step into this space for people to affirm their gender the way that works best for them, without the barriers, in a self-determined and fully autonomous human rights way. And it's folks like everyone in this panel and all of the audience members that really do contribute to us more and more having the opportunity to live an incredible life.
Absolutely. So, one of the things that Teddy and I do as part of our job, we are essentially the trans health equity kind of division in at ACON. And so we love hearing from you, talking to you, being in touch with community, finding new ways to reach out and be reached out to by community. So do not be a stranger. Get in touch, get in the comments of here, send us an email, get in the contact form at Trans Hub. We can't wait to hear from you. And I think that's our session. I hope everyone.
Let's do it.
Yeah, let's pack this up and go. Well, we can't really go home. That's not really a thing anymore. Let's pack this up.
Wash our hands.
Exactly.
Race to wash your hands.
Good night, everybody.
Right.